Hey, I'm Amy Rivers. I'm the lead nurse for Henry County Schools. I just wanted to remind you about the symptoms checklist that we have. It's on the Henry County Schools webpage. So each day before your child comes to school, do this little checklist so that you can make sure they're well enough to be at school. So it's just got some check boxes so that you can check off and make sure you've covered everything. It covers the symptoms that are possible for COVID-19, which are cough, nasal congestion or runny nose, sore throat, diarrhea, nausea, vomiting, headache, loss of appetite, fatigue, muscle pain or soreness, temperature greater than 100.4 or chills, shortness of breath or difficulty breathing, and new loss of taste or smell. So each day before your kiddo comes and gets to school or gets on the bus, we want you to do those checks and make sure that they are all good to go. If they're having any symptoms, please keep them home and let your school know that they're staying home. They should not have to use a fever-reducing medicine to have a fever come down. We want them to have no fever for 24 hours before returning. And if they have any known exposure to COVID or you know of somebody that they've been around who had COVID, we want them to stay home so they can switch into remote learning and stay home. Let the front office know with a phone call, and then we'll help you get back into school from there. So the form is on the website. If you have any questions, call your school and ask them, and we'll be glad to help you out. Remind your child to wash their hands often, and especially before touching their food or their face, and watch their distance so that they're keeping their 6 feet from people. That's a major key to preventing the spread of COVID-19, and wear their mask.